Well, we are here at Tri-Cities Functional Medicine in Johnson City, and we are joined today by the owner and medical director, Dr. Joseph Radawi. Dr. Radawi, thanks so much for having us out today.
Well, I appreciate you guys coming out and joining us.
Well, really interesting to sort of hear your story and what you're offering to the community and sort of getting everybody on that right track to good health. Let's kind of start with the background a little bit of how this all got started.
Yeah, absolutely. I mean, I've been practicing medicine for over 15 years, and when I finished medical school, I did my residency in family medicine. It's a 3-year training program, got board certified. At that point, I felt like I could make the biggest difference practicing emergency medicine. So I moved my growing family from Arkansas back to Tennessee, and I spent a decade practicing emergency medicine. Got to work with a lot of great physicians, nurses, and we got to save a lot of lives. And what I found is we're really good at crisis care. And towards the middle and the end of my ER career, I started to notice more acute on chronic conditions coming in. And just felt like we were just putting Band-Aids on things rather than actually getting down the root cause. So I knew if I really wanted to impact my patients' lives and really get them healthy, I needed to do something different. And that's when I went on and got further postgraduate training in functional medicine. And so I did that through the Institute of Functional Medicine. They're affiliated with the Cleveland Clinic. And that's when I got a whole host of new tools to really be able to offer my patients and really how to get down and figure out what that root cause is, do the right testing there. But more importantly, being able to educate them on functional nutrition, exercise, sleep prescriptions. Even one big thing that we think about is stress, understanding that too. And that's really what we're able to do with them and really walk them back to health.
And I know this got very personal for you back during medical school as well, and that sort of changed you, shaped you a little bit too.
Yeah. I mean, that day really did impact me, and I remember that pretty vividly as in medical school. And the phone rang. My roommate Brian, he was downstairs, and he told me it was my mom on the phone. And so I went down and got on the phone with her, and I could tell immediately that there was something serious going on. And she shared with me that it was my dad, and she told me that he had a second heart attack that ended his life at the age of 59. And that really struck me because I began to realize just how important health is and what it means to those around us. And unfortunately, he never got to be a grandpa to his 3 grandsons or even got to be the best man at my wedding. And I knew that health is important.
And he was 59, and unfortunately, we continue to see that. And I understand that's what really helped you decide, I don't want to treat the symptoms anymore. Right,
I know, because I see so many of our practice members that initially come to see us, and they're dealing with, fatigue, depression, anxiety, even just that stubborn belly fat that's hard to get off, and even just chronic pain syndromes that really keep them from living life to the fullest. And I knew that I needed different tools, because it's frustrating for them too, because they can be doing everything right, even eating right, exercising, but they're still dealing with these frustrating symptoms, and there's more to it that we need to understand from that standpoint. And gut health is a big part of that. And what do I mean by that? Let me kind of explain that. Is if our body's not balanced and functioning correctly, then we can be doing everything right, eating in the Garden of Eden, and we're still not going to get that benefit from that. And there's a lot of things that play into kind of gut health, what we call gut permeability, leaky gut. Even hormones are pretty important when we look at stress hormones, just even when we look at estrogen imbalance. And thyroid is a big factor there too. And it's important that we understand how to address those and get the right workup and test. And then not only when we do that, but also be able to be educated on what to do about it.
So really getting to the root of the problem, and you sort of showed me around here.
Sure.
And it is not a typical doctor's office. You have very interactive rooms and tools for people to kind of approach medicine in a different way.
Absolutely, and that's one of the challenges too that we're seeing. I think really a lot of people that I talk to realize that we have a healthcare crisis, But it's not the doctors or the healthcare providers, but the system that we operate within that's challenging. I mean, when we look at not having enough time, generally we only get about 7 to 10 minutes nationally to spend with a patient. That's just not enough time to be able to get down to the root cause, work them up, but more importantly, be able to teach and educate them the right tools that they need to actually walk themselves back to health. Another challenge is because of that, we're seeing kind of this rise of health conditions. I mean, we're seeing autoimmune conditions, cancer, heart disease, just you kind of name it, and it's going. And think about it, as we're advancing and doing this, we're actually spending more money, and we have to actually ask why. And one of the challenges that I see is that we're spending that money in an education system that really teaches disease management. And we use tools like drugs and surgery, and sometimes that's necessary, but we're just kind of putting Band-Aids on things and not really actually getting down to the root cause. And that's really how we're different there, to really get down to that and do the right work up there. Because the biggest thing that we see when we think about what we're really good at in that system is crisis care. But that's only about 10%. You know, and that's what our conventional doctors are really good at. And I'm one of them. I saw that firsthand. But the bigger issue is that 90% of those chronic degenerative lifestyle cause diseases, and if we take that approach, then we will be just putting Band-Aids on things rather than actually walking patients back to health.
So you put them with the education, taking a look at what the problem might be, and really investing in themselves and their health.
That's right. And sometimes it's kind of one of those things like, well, how do we do that? And how do we actually get started? And one thing that we like to do is even on the front end be able to educate those that want to come see us, because we are different. So we actually do that through our live free live seminar talks and also webinars, so that we can make sure that it will be a good fit, you know, so we can start to move and transition down to that one-on-one consult and really start to look at your health concerns, your goals. But more importantly, be able to customize the individualized program that works for you.
All right, well, we're going to give everybody the information again. It is Tri-Cities Functional Medicine, and it is right here in Johnson City, inviting you to come by and meet Dr. Radawi and the rest of his team members here. Thanks so much for having us out today.
Thank you.
The preceding portion of Daytime Tri-Cities was sponsored by